Good morning, everyone. My name is Marlene. Today I'll be assessing the head and neck assessment. So the first step is to identify the patient and explain the procedure to the patient and perform hand paging.
After that is we're going to perform our hand paging.
Next step is
Assessing the head and the eyes. First is we're going to inspect the head and the face for color, symmetry, lesions, and distribution of facial hair. And we're going to look the facial expressions. And we're also going to possibly and my
next is to assess the head and the face color, note the lesions, the symmetry, and note also the facial expression and palpate it.
After that, we're going to inspect the external eye structure such as the eyelids, eyelashes, eyeballs, and eyebrows, and cornea.
Next step is to assess the external eye structures, the cornea, the conjunctiva, sclera, and note for the edema and the alignment of the subject.
After that, we're going to examine the
The next step is to using a pen light the pupil one time. One at a time. Next step is to ask the patient to focus on one object and move it to in front of the nose.
and convergence, we're going to ask the patient to focus on an object as the patient towards their nose. So focus on this object.
Next is using the Snellen's chart, ask the patient to read the smallest possible letters. Next is to using the 6 cardinal position of gaze. Ask the patient to follow your finger and move your finger one at a time without the patient's neck moving.
And first is both eyes and one eye at a time. Doing the position of the smallest possible line.
Now, we will proceed to the ears, which is to palpate the external. Next is to, using the adult method, pull the auricle up and back.
So, about 2 feet away. I'm ready to ask the patient to focus on his finger.
Next is to perform the nose, palpate the nose, external nose. Next is to gently percuss the frontal and maxillary sinuses.
So now that we are done
Next step is to
now we're going to proceed to the ears. So first is we're going to inspect the external ears bilaterally, shape, size, position.
Occlude the external nostrils with your finger and breathe let the patient breathe with your arm.
After that, we're going to perform an otoscopy.
Next is to we will inspect the internal nostrils using the otoscopic using with a speculum attachment. Now we will proceed to the mouth. Okay, so perform hand hygiene.
After that, we're going to use a whisper voice to test for hearing. We're going to stand about 1 to 2 feet away from the patient, out of their line of vision, and we're going to ask the patient to cover the ear that is not being tested and perform each test. For the lips and the can you please cover your left ear
using the
can cover your right ear, sir.
Expect the
Sir,
patient by asking
and we're done with that. We're going to proceed
Inspect
to
the mouth and
use
but
of
lips,
report to
gingivate,
perform
teeth,
liver's test
liver
and
glands.
French
Ask
test
the
if
patient to open
reports
wide using
diminished hearing
tongue
in the
plate
ear.
and a pen drive.
and then ask the patient to say
Patient ear. Both.
after that from the accessing
Let the patient stick the tongue and ask the patient to say check the uvula.
expect the external neck
Now we'll proceed to the dispose first. We will proceed to the
Now that we're done with the ears, now we're going to proceed to the nose. So we're gonna do is we're gonna inspect and palpate the external nose.
for the posterior neck. Check for the
And after that, we're going to palpate lightly percuss over the frontal and maxillary sinus.
posterior triangle neck and posterior cervical.
Ask the patient if I hear the
Posterior cervical.
And after that is we're going to occlude one nostril externally with the finger while the patient is on the other.
Next
And
is
with
to
the
assess for the anterior triangle neck and anterior cervical lymph node from the chin to chest and left ear
after that,
to
we're going
shoulder.
to inspect the internal nostril with the use of otoscope with the nasal speculum attachment.
Next step is for the anterior neck.
Now
Inspect
we're
and
done with the
palpate
nose,
the
we're going to
cornea.
proceed to the mouth. So first is we're going to palpate the central maxillary joint by placing our index finger over the
Next is
front of
to
each ear.
Check for
And
the
we're going to ask
thyroid
the
gland
patient
if
to
enlarged.
open the
palpate the
If enlarged, use a stethoscope and oscillate the.
After that is we're going to perform our hand hygiene and wear our gloves.
Bagatua.
And next step is to inspect for the supraclavicular area.
Okay, so after palpating his ears, let us now pull the ears further up and
Next is to perform hand hygiene and document the assessment.
Just pull it down and
after that all the procedures formal hygiene
we're gonna check for his